Okay, well, tell me about your life and how this is affecting you. What you're an interior designer, correct?
Well, at this point, I can't really, like, it's my right arm, so it's really hard for me to be on the computer because hold the
Hmm.
mouse is like I can draw with this, but it's really hard. So I have not been doing that. I can't work out. There's no more tennis for me, definitely. There's no
Hmm.
more spin classes for me, for sure, because like when you're standing, like you kind of like put so much pressure. So I've not done much exercises in the past half a year, which is really, really like making me feel anxious. And I mean,
Yeah,
I
yeah.
I usually work out 5 times a week, and now I'm just like, what? Can't do
Yeah, we
much.
work out our stress, and when we can't work out, our stress
Yeah,
stays in us. Yeah,
yeah. So
yeah.
right now, I like it's. I mean, it's kind of taking everything away. And I don't know, like some days it's fine. Like I was sick for a few days. I wasn't really thinking about pain, but I know it's there. I feel like
Yeah.
after 6 months or so, like you kind of get used to it, like being constantly in pain. So I wanted to go away. I
Yeah.
wanted to walk it off.
You want to walk it off? Yeah. I wish you could walk it off. That would be so great. This is one of those things. I think it's so weird because you look at someone from the outside and they look normal, but on the inside, it doesn't feel normal. And in fact, it's affecting your personal life, your work life, your recreational life. It's affecting your entire life. And that gets into relationships. It's really, really hard. And then, you haven't talked about it, but most people who feel pain since September, October, November, December, January, February, March, 7 months of pain. Pain is to tell you to take your hand out of the fire, and your hand's been in the fire for 7 months. And so it starts to really depress and wear on people. All right. Well, we know it's bad. We know it's affecting everything.
Oh
Now
God.
let's take a look at what it is. And I'm going to share your MRI with you. Come down into your neck though. This dark area is your spinal cord. And
Mhm.
see how we're turning backwards here?
Yeah.
We should be turning the other way. Your spine should be shaped like this, but
Mhm.
yours has a deformity where it curves back the wrong way. And when you look at a deformity, when you look at the apex, the point where the most is, that's this disc right here.
Mhm.
And here are the bones 2, 3, 4, 5, and 6. Between 5 and 6 is the apex of the deformity. And if we look over here in this image, we see your spinal cord. And on
Mhm.
the left side, there's a foramen, which is the hole where the nerve root comes out. But on the right side, see this?
Yeah.
That's your ouchie. That's what
Uh-huh.
hurts. That's what causes all that darn pain. You know what's
That's
interesting? I hate you. Let's take an eraser and just erase that thing and we'll be good, huh? Yeah, that's your issue, without a doubt. That nerve root, by the way, is the one that goes down the arm and into these two fingers. So that nerve root being irritated and compressed by that disc herniation and
Mhm.
that deformity, that's the issue.
Okay. So is it because why wasn't it so painful for all these years and now it is?
That's such a great
Was
question because the deformity was always there. That didn't just happen, it's been there forever. What
yeah.
happened was the deformity caused an extra wear and tear on the disc. The outer part of the disc, when you were playing tennis, ruptured, and
Mm.
some of it came out and started to irritate the nerve root. And then when you were doing yoga, even more happened, and the irritation created this damage to the nerve root. In 90 to 94 out of 100 people, it will just resolve on itself. It's having a really that's within 3 months. You're seven
Mhm.
months and it's having a hard time resolving because of the deformity. So the combination of the two problems is what's making it so difficult for your body to get better, whereas normally it would.
Okay. So it's going to be something bad, you're gonna tell me.
I mean, you have a decision to make and only you can make it. There's no, so of all the kind of spine treatments, there's dozens of treatments, right? You can do traction, you can do yoga, you can do acupuncture, nonsteroidal anti-inflammatory drugs, hot
Mhm.
packs, cold packs, moist heat, there's all these things, but because of your specific problem,
Mhm.
herniated disc failed to get better over 7 months in the setting of deformity. There's only one thing which is effective for that, and that is
Surgery.
yes, ma'am. And the reason is the
Mhm.
deformity has to be corrected, or it's just going to happen over and over again. And so there is an option of waiting it out, but we're 7 months into this and that's not working. It's affecting your life. I mean, it really, and
Mhm.
it's not that it will never go away. You probably could have good times and bad times, and you could probably get through this. You could have epidural injection to help it calm down a little bit, but it's very
Mhm.
temporary and, it doesn't really make sense to me. So
Okay.
the definitive treatment is definitely the surgery, and all the other treatments are not going to be super effective.
Okay, so with that, what are the chances? And like, I don't know. I've never had a surgery or something that would be, um, so serious. I would say because I mean it is close to my spine. It's close to my head. Like I don't want to be like at some point like, oh my god, it will go wrong and I'll get paralyzed. We don't want that. This is like the biggest fear probably. So tell me, what do I do? And what is it
Well,
going?
so that's a normal fear. Everybody's afraid of paralysis. Of course they are, right? Because that's what would be the worst possible, one of the worst possible things that could happen to anyone on this earth ever.
Uh-huh.
But that's not going to happen. It's extremely, extremely, extremely unlikely. Your
Okay.
risk of paralysis is actually not very insignificant right now. If you
Uh-huh.
were to, because of the deformity, if you were to move wrong or get in a car accident, there's not a lot of room around that spinal cord right now, and more disc herniation really could cause a very serious neurological problem. You're not having any bowel or bladder control issues. Everything's working normally. You have good strength. Yeah, let's keep it that way. So
Well, I'm
no,
strength in this.
you have
I,
loss of strength in the hand.
I did
Yes.
go to chiropractor and they did like this whole thing. Of course, told me that my spine goes like my neck goes the other way. I mean, I know, but then they were like, we were doing this exercises when I had to like hold something, and he's like, "Yo, my left arm is way stronger than my right
Yeah,
arm."
you've got motor weakness, and that's only going to get
Mm-hmm.
worse. So the risk of so what would be done in surgery is they would make an incision here in your neck, go in and remove the disc, put a spacer in there, and then a plate to realign the discs. Some surgeons would want to do that at 2 levels. Other surgeons would only want to do it at one. It just would depend on the surgeon and the way, from your point of view, on the outside, it would be the same. No young lady wants a scar on their neck, but they can usually place the scar within your normal crease of your neck. So it's very cosmetic. It doesn't stick out very much. And if your skin heals well, it would likely be almost unnoticeable going forward.
I'm Eastern European. I have scars that don't go away for like decades. Ugh, like dark and horrible.
Why do you say that Eastern Europeans have bad scars? I think it's
They have
I think it's
really white. Like it's the skin is so fair. It's like it's impossible to get rid of the scars. I have couple and they still. It's been like 4 or 5 years and it's not going away.
well, let's assume in the decision making that you would have a scar on your neck and that you would have to
Yeah.
cover it with makeup or do whatever you would want to do with
Mhm.
it. But compared to what?
It's not even really about the scar. It's like I think it's more of a scare for the the whole situation. Is it gonna get better? What's the recovery
Yeah,
time really from that?
it's a very quick recovery from that surgery.
Uh huh.
About a third of people, as it just so happens that your feeding tube, your esophagus, is in the position where they need to access. So they're going to slide it out of the way. And when it comes back after surgery, about a third of the people feel kind of weird when they swallow food for a week or two. So
Okay.
those people have to have, you eat pudding instead of steak. You have a week or two of you extra chew your food. You eat with extra water. That
Okay.
typically goes away. There's an outside risk of damage to the esophagus or of permanent hoarseness, but the risk is very close to zero. And compared to the other risks you're taking right now with the progressive weakness in your hand, it's very, very low. You'll be
Okay.
back at work, back in front of your computer within a few days. You won't feel like working a full day for about a week. Once you come back, you get, after 3 weeks, your bone is starting to settle in. By 6 weeks, it's starting to knit together. By 12 weeks, you're fully healed and you're no restrictions. Some doctors want you to wear a cervical collar during that 12 weeks of bone healing. Others, no collar. Others, just a week or 2 or 3. Have you seen a surgeon? I can't remember. Have you seen anybody? Okay, so
Either.
you have to go see a surgeon. Once you make a decision, if you decide for surgery, you're going to have to go see a surgeon. And different surgeons are not all the same.
Uh-huh.
They're going to give you their opinion about what they think and how many levels and whether you should wear a collar, but you'll be ready for that discussion because you'll know what those issues are.
And what's the name of the surgery?
So the surgery is an acronym, ACDF. A is anterior, C is cervical, D is discectomy, and F is fusion, ACDF.
Okay. You said 12 weeks?
Well, it takes about 12 weeks for the bone to really knit in there fairly well. And it really continues to heal for about a year. But you should think of the recovery, the total recovery. In 12 weeks, you should likely be without any restrictions, playing tennis, enjoying your life with no complications or swallowing problems or anything like that. So you want to kind of think about almost like a quarter of being a little bit down.
Quarter. I'm just trying to think.
3 months.
All right. So I need to be in pain until the end of June. Because before that, I can't do anything.
It's usually not painful after. The pain is usually
Well,
gone when you wake up. The arm pain is usually gone when you wake up. So
no, I'm just saying, I'm just thinking, like, I have plans.
we can look, if you make a list of people you think might be good, then the next question to answer, make a list of neurosurgeons who look like they might be near you and impressive. Maybe somebody at UCLA, someone who, read their bio, see who seems to fit with you. Call the office and ask them how many ACDF surgeries the doctor does every year. You want to get a sense of volume. You're really looking for someone who does at least 100 of these a year. So that's 2 a week. And if they say on the phone, I don't know how much the doctor does, say, well, how many is he doing next week? Is it 0 or 1 or 4? Like, what is it? And if the number is less than 2, then maybe find somebody who's doing more of them. You want that volume and that repetition to keep you safe.
Got it. What if I decide to do it in Phoenix?
Yeah, you could do it in Phoenix. There's nobody here that's better than anybody there, but there are good people here too, for sure. And we
I
go through
just
this.
have better support system there than here.
Well, no problem. Same process, regardless of the city. We'll make a list of. It'd be easier for me to help you with that here because I know the people here. But make a list of the surgeons who look good. Research them online. See who. It's very much a fit. You know what I mean? You look for. Oh, I don't like the look of that one, or oh, I think that one looks really good.
Yeah. Okay. All right. So, but wait, your hospital, like your facility, doesn't do that. You don't.
We do. Yeah.
Uh-huh.
But you want to look at everything. We've got great people, but you definitely want to look at everything. But I would certainly put, there's a surgeon who works in one of my surgery centers who I would definitely put on the list and have you talk to him.
Okay. Yeah, I was like, why are you not saying about you? I know you're not practicing, but
I can't practice, but we've got
yeah.
we've got great surgeons, and there's a lot of people here who I would trust with my neck and my life, and so I would trust them with yours too.
Okay. All right.
Yeah.
Good to know. Oh my gosh. All right, Doctor. Then thank you.
You're welcome, Katarina. Let me know if you have any other questions, okay?
Okay, I will.
All right. Have a good day.
Me too. Bye.
Bye now.